All right, good afternoon, everybody. Welcome to Recovery Reimagined from Silos to Systems. I'm Kevin Moorhead. I'm the Senior Director for Cause Funds at Charitable Impact. And I'm so grateful for everyone spending the time with us today. To start, I have to say that addiction is a very personal issue for me. It's had a profound impact in my life, and I know that I'm not alone. And in the last few years in Vancouver, I've had so many conversations with such a diverse group of people who are all deeply concerned about this growing addiction crisis, what it means to our own personal lives, what it means for our province, for our city. But we often don't know what to do. We're often left pessimistic that there's no solutions, no answers. And that's what this conversation is about today. Today, we're going to look behind the cause of addiction recovery. And we're going to ask the question, what do we need to do to address this crisis? And who are some of the people on the front lines of change? And I'm delighted to be joined here today by three such people, three incredible thought leaders. We have Guy Felicella, very well-known international speaker, advocate, and advisor with Vancouver Coastal Health. We have Stephen Hall, the public relations manager of Together We Can, as well as Susan Hogarth, director of planning and development, also at Together We Can. Thank you so much for joining me. I want to do a reminder as well that I will be speaking for about 30 to 40 minutes. I'll be asking some questions. I would encourage everyone here to put questions into the chat. We want this to be interactive and participatory, and if anything comes up that we don't cover, please do put in questions, and I will be able to get to them at the end. So, Guy, I'd like to start with you. I have to say it's been a pleasure getting to know you a little bit over the last few months. Your story is a compelling one. I won't steal your thunder, but you struggled with addiction from a very young age, and unfortunately, you ended up on the downtown east side for quite a long time. I wonder if you could share with us, what did the world look like for you on the downtown east side, and what did you need to begin that process of recovery?
Yeah, no, thanks, Kevin, and thanks for always having me. I'm always humbled to be able to, share some components of my life. I mean, there's no doubt I'd struggled. I had a lot of undiagnosed learning challenges as a young kid that I wasn't diagnosed until I was about 38 years old. One being ADHD, which really impacted my life, but and traumatic upbringing through a lot of trauma and abuse in my household, which, you know, in my world, I was more looking for distracting myself because I was unable to cope with the way I felt. And that became a process that really kind of navigated my life through an early age. You know, when you're wanting to end your life and you're looking for something at a very young age to try to keep you going, and you find drugs and you believe those drugs can take the pain away immediately, but at the same time, which no 12-year-old could realize, is that the drugs that were saving his life were going to progress into an addiction of substances that were going to try to end his life. And, went through, very young age at the criminal justice system, involved with gang activity as a youngster, and, the made a provincial ward of the court. So I was, constantly being moved around, and just my whole world was very unpredictable. And the one thing that gravitated me to the downtown east side was the ability to have some familiarity with seeing people struggling with pain, because oftentimes people who do struggle, we feel often isolated and alone. And although it is an isolating journey, you're by yourself, but being surrounded by people in that community that were also struggling was somewhat comforting. But it also at the same time it was killing me. And, I struggled through there for decades, being homeless, in and out of the criminal justice system, hospitalization stays, in and out of the treatment industry. I was always attempting to go to detox. I can't tell you how many times I've been to detox. I can't tell you how many times I've been in and out of prison, and I can't tell you how many times I've been in and out of the treatment industry. And my whole life just was engulfed with pain, and really, which gravitated me to looking to make some changes later on in life. But it was a long, treacherous process, and thankfully, I had a lot of supportive people throughout my life.
When I had lunch with you last week, I couldn't help but notice the tattoo on your neck. It's your wife's name, and I wonder, could you share the meaning of that tattoo and why that matters for your recovery journey?
Yeah, I mean, my wife was seriously instrumental in changing the direction of my life. We met in 2010. I was in a recovery place. I stayed sober for a year, and then I relapsed, and it really separated us. For 2 years, I went back to the downtown east side, and then 2 years later, she drove by in her car and saw me in front of the supervised consumption site and pulled over, got out of the car, and gave me a big hug and put her hands on my face and said, I can't wait for someone that's not going to do anything about changing. And she said, you need to go get help because this is not the person that I know inside. And, a very emotional moment. I went to go and try to get help, but I left detox 2 days later, which was somewhat normal. And 6 months later, I'd written her a letter and told her that I was going to a recovery treatment center and, probably moved on with your life. And I wrote this letter apologizing for the things that I said and that she was there to support me. And even if she didn't want to see me, that I just was very grateful that people cared. And she showed up there 3 days later and basically, was the one that said, if you're all in on changing your life, then I'm all in to help you change it. And so
Mm.
this woman, sacrificed going to school to be a master's degree in clinical counseling and, worked full time while I was trying to gather my life together. And she was the one that really just, taught me how to live, and function as a person in society because I honestly, I didn't know how to do it. And I think a lot of people struggle with that is that they just don't know how to live life. So I needed someone to, not to tell me how to live, but to show me how to live. And I've always said that if you could have that person, I hope somebody finds that person or that connection with people to get them to where I am.
That's what really struck me when we were speaking is just how beautiful a symbol that is of that connection that you had in your life. And I was thinking as we were speaking, like, gosh, I wish that everybody had that type of connection. And I think that matters for this conversation because I think, when we're talking about recovery, it's every time I hear a story, it's all about the connections we have with each other that really seem to matter. Susan, I know your story is different, and you didn't end up on the downtown east side, but so many of us can relate. You had a very different path, and you had your own demons to wrestle and your own struggles with addiction. But tell us a little bit about your recovery journey and how the recovery system either served you or failed you, and how did that work for you? Oh, Susan, you're muted. Oh,
There,
still.
I am on mute. Sorry. Hi. Thanks, Kevin. And thank you for sharing your story, Guy. I really love listening to your story. And I love the parallels of that we all have, when we're in recovery. I grew up in a regular home, in a neighborhood, and we all had those secret demons, and kind of violence and addiction behind the scenes that nobody knew except that the family unit ourselves, right? And so my father was an addict and I was an addict. And, I was like a latchkey kid. I grew up as a latchkey kid. And because of that, I was left to my own devices. And, you know, the crack showed early. I went, met the wrong kids. I followed the wrong crowds, and my behavior became reckless at a very young age. And my addiction started, with sugar and then alcohol and smoking. And, it was kind of just a progression over 40 years. And, I was really fortunate because which is a weird thing to say because when I was a preteen, I was actually wound up in the foster care system, and I was super fortunate to wind up with a fantastic family who had great values, and I felt safe for the first time in my life. But despite that, and despite my calls for help in like the schools and, the church counselors, there was really no help for me to be able to deal with any of the trauma that I had experienced growing up. And so what resulted is that I just wound up picking substances up again to like mask the feelings that I had inside of me. And so, I started using, and my life just got more and more chaotic, and more my disease progressed more and more until I crossed every single boundary that I said I would never do. And then I reached out for help, and I reached out for help, interestingly enough, to the foster parents who had originally came to my rescue as a child, right? Which was really quite fantastic. And they were just really great and supportive. And what happened is they took me to my sister's, where I was put on a wait list for a detox bed. And I was told that the detox bed would be 10 days. And so what happened was I wound up detoxing, in an unsafe space where I was having alcoholic seizures that I didn't know were alcoholic seizures until now. And when I finally did go to detox, I was then told that there would be, a 3-month waiting list for me to be able to access any treatment services. And so because I did kind of have a manageable life. I owned a house. I was a mother. I had a good job. I still had a car. I wound up selling my house to pay for my treatment. And that is something that I talk about a lot because, that is really, I have a disease of which there's no known cure. And I had to sell my only asset that I had for my whole life to be able to pay for my treatment so I could stay alive. And further than that, I also paid for private psychiatric therapy. I paid for all the different services that I could get in the treatment center just to get me well. And then I just got embraced by recovery, and I became really passionate about helping others. I began sharing my story across Canada as a recovery addict, and I've just thrown myself into helping others. And it is because of the people that I've met along the way and the connections that I've made that I've been able to do that. And one example is that I was introduced to a grant. I was able to get my master's in business administration. And that's just really helped me to be able to advance what I'm wanting to do in my life right now. So, I think if I wanted to say where were the gaps and what happened, I would say, like, why wasn't the school counselors listening when I was talking? And where was the justice system when I was a person that was arrested 11 times for impaired driving? Like, there was so many opportunities for intervention in my life, but there was no connection within the system to be able to support me, to be able to help me out of this crisis that I was in. And so I think that the systems today really need to be linked together, and they need to be communicating, especially when people are in crisis, to be able to offer services like right throughout the continuum of care.
Yeah, I
So,
mean, that word connection is going to come up over and
yeah.
over again in a helpful way. And, it's connection between people, but also connection between people and services, and between services and services, that we need a system that's more integrated. But, another word that really comes to mind listening to both of you is courage. And I just have to take a moment to thank you for sharing. These stories are they're deeply painful, and I get that. And so I really do admire that you've had that courage to share with others, because it really is helpful. And on that note, Stephen, if you don't mind, I wouldn't mind sharing that about a year ago, I was at a gala for Together We Can, and you had the courage to share a story from your mom.
Mm.
And I have to say that it was a video, and it really hit me hard. And it still sticks with me today to see your journey through her eyes,
Mhm.
and how grateful she is that for the person you are today, and how recovery mattered to her, so it was incredibly impactful. And I wonder if you could share some of the factors in your life that were most important to take you from what was a very dark place to the extraordinary human being success you are today.
Well, thank you for the compliments. I appreciate that, Kevin. First off, I do want to thank both Susan and Guy for being here and sharing their story and being a part of this, and Kevin and Haley and the team at Charitable Impact for all the work you've done on the recovery ecosystem. But yeah, similar, I don't get too much into my backstory. I had a different childhood than I think most people would. And as a result of that, I had a lot of freedom. And, I learned about drinking and using substances early in life. Around the age of 12 is when things started. And, by 13, 14, I was using hard substances and partying all the time. It really took hold over 15 years of actively using substances. It was probably the last 3 years of my active use was one of the was the worst, to be honest with you. Not sorry, was not one of the worst. It was the worst, and similar to what Susan shared and what Guy shared is like it brought me to places I didn't think were imaginable. I never thought I would end up there, right? So. But coming into recovery, I wasn't exactly beaming, light ray of sunshine and self-confidence. Some of the key points that actually brought me to recovery, though, was, my family, they stuck beside me for a very long time throughout my whole addiction. And obviously, they set boundaries and did all those things with me. But one of the tipping points for me was when my mom looked at me actually in the eyes and she said, "Stephen, I don't trust you anymore." That was one of the big catalysts for me to actually get some help. And, it still took me a little while to reach out and to get the support. Um, but yeah, when I look at the different factors that led me into recovery, it was a lot to do with my family, but also mental health. I was never one. I have a high bottom, if you will, or a middle bottom, or whatever people want to define it as, where I was never homeless, and I was working, and I had these things, and I always thought that because I had these things, I wasn't in addiction, and so that kept me in addiction for a very long time. And so, some of the other factors, though, when I look at my journey of like reaching out and things like that, I'm from the West Kootenays, so it's a very small trail, BC, and I'm actually from an even smaller town beside Trail, BC. Um, I was kind of reaching out for help. I was able to get counseling once a month from the mental health and substance use office. I was able to go to a relapse prevention group once a month. And, the rule was that we couldn't use substances if we're going to that group that day. And I mean, nobody followed that rule simply because there was no sort of accountability or anything around it, right? And that's what I was doing. That's what I did every day was use substances, right? So when I finally recognized that, hey, I deserve a little bit better than what's going on here, and so does my family and all these people, and I can actually have a good life. I came out to Vancouver here for treatment. That's where I was able to get services right away. And so, I count myself as one of the lucky ones. I did come through government funding, and it just so happened though that a bed opened up and I was able to get into that bed, right? The reality, though, is today, when it comes to government funded spaces or those types of spaces, the wait lists are massive. They're 60 to 90 days. And these are people that are reaching out and want to make a change. That's the thing. They want to make a change. They're calling every day saying, "Can I have a bed? Can I have a bed? Can I have a bed?" Right? And we should be able to help those people. So that's a lot of the reasons why I do what I do today as well.
Yeah, thank you. And when we met, you work at Together We Can, which is an incredible, Vancouver-based but province-wide recovery service. I was amazed though when I first met you that you immediately started talking about the entire system of care and not just your own organization. And that's where this conversation about recovery ecosystem was born. So, Stephen, I want to put a fine point on it here. So I know that there's a lot of good things happening across BC. There's a lot of amazing service providers. There's
Yeah.
acute care is getting better. We've seen great progress. So what is the problem we're trying to solve with recovery ecosystem?
hmm Well, there's two main problems that come up right away. First is the silos. So right now, if you look at the addiction recovery or even just the treatment of it, the sector is a lot of organizations are fighting for the same dollar or same piece of $1. And so there is quite a few silos that have actually been built up in between organizations. And so obviously with that is people are not being collaborative and sharing best practices. The people really that are getting stuck in that though is the individuals that are reaching out for help, right? And those are the people that we need to be able to work with. And the second piece is there are a lot of great service providers out there. But because we're not communicating and really the funding's not trickling down where it should, there's some service providers out there that are doing great work in rural communities. But I'm going to share a story to make a bigger impact on this. Is we were in, I think it was Duncan, and we met these two ladies, and they were running the soup kitchen in the community. These two retired ladies, and they went in there and they opened every day and they closed every day and they prepared all the food and they cleaned and they did all of this stuff and they did that 7 days a week. They don't have time to sit down and write like giant RFPs. They don't have the resources to do those types of things. So they're already at a disadvantage because they're not going to be able to apply for a majority of the funding that's out there. They're just depending on small donations. So when we look at that, we have really good service providers that are experts in their field. They're experts with the people on the ground that are using the services. But the unfortunate reality is they're not being invited to the table right now. And so again, there's, the health authorities, the province, there's lots of nonprofit, there's some for-profit people operating in the space. There's lots of great services out there, but we need to connect it all. And so we also need to encourage participation in between service providers to ensure that the person that's using these services is not falling through the cracks or being held up at one point.
So the word ecosystem is really about connectivity between the different pieces of the puzzle within our system.
Mhm.
Now, Guy, when we met last, you talked about being a renovator. I'm sorry if I'm getting your language wrong, but I liked how you made this analogy, even in your own life, that you're a developer and you need to renovate. But if you take that to the level of a system, like how do we renovate our system for recovery to make it work better for people?
This is the $1 million question. I think, yeah, you can see things, and I see lots of stuff that works. The unfortunate thing, it's not on a straight line. It's bounced around, or you have to tell your story 10 times to 10 different organizations in order to get to where you needed to get to. And it's like that can be a huge process for people. It can also be very triggering to people. I think what we have to do is look at the system that we have, look at what's working, and then say, how do we actually connect the services that need to be connected to what is already working? And then what's not working, we don't even have to touch. We just have to change what's not working into making it what is working. And there's lots of things that are working. I think where I come to, especially, I've worked with people who have lots of money, and I work with people who have absolutely no money. I will tell you this. The people that do have lots of money when they complete treatment also have a lot of social determinants of health that are addressed. They've also lived a good life. They've had a job before. Maybe they tanked their job and lost their family, but they've gotten everything back and they were given opportunity. I do not see the same things for people that struggle in marginalized communities, people on the street, people who have to be having a little bit more support. So in the process of looking at the systems of care, for those people, they deserve the same opportunity. I've said if somebody goes into treatment and puts the work into changing their lives, then we have to be there to make sure that there's little components of top ups to help them get to the next step, to be encouraging, whether it's going back to school, whether it's showing them how to build a resume, whether it's like driving them to get their first interview for a job. All these things, ID, housing is a big thing. And we'd be pretty naive to believe that if we address addiction, we're going to address the challenges on the street. Sure, you'll address some, but however, I think people need to have some sort of knowledge of not being able to go back to what they're trying to break free from. And I don't think that actually is the reality in a lot of people's lives that I work with. They're fearful of having to go through trying to change only to go back to what they're trying to escape.
So I'm hearing equitable access as a critical piece of this, and clear information about what services are available and how to navigate them. And Susan, I know that you've been having conversations with local communities, and I want to kind of, this is a bit of a conceptual discussion at the moment. Let's take this down to the level of a community where how would this work if you, I think it was Duncan where you were having discussions, or I can't remember which community you were in, Susan, but how would this recovery ecosystem work at a community level?
Thank you. I really love that you asked that question because, it's so important for communities to bind together to end this crisis, and not just the overdose crisis. Similar to what Guy is saying, it's not just about addiction, it's about so much more. Because if you address the addiction, you still need to have a safe place to live. You need to have some purpose in your life. And so one of the things that we know, as Stephen was saying, is that there is a fractured system right now, and it boils down to, money, ego, and turf. Everybody's fighting over the same money. They want to provide their service, and they believe their service is best. And a lot of folks aren't open to different ideas and to working with each other. And there's a little bit of bias there. And so how the recovery ecosystem would work in a community is that everybody who had a service available would be able to come into the ecosystem with their service. And then people who need to use services could enter into that ecosystem at whatever service level they need at the time. It could just be a doctor's office. It might be a food bank. It could be a shelter. It may be, like your bank. Who knows? Like whoever is involved in the ecosystem that's providing services. And the reason why I say bank is, circling back to what Guy was saying, when we originally were speaking about this idea of the recovery ecosystem, he brought in that contingency plan and that incentivized treatment. And we thought that if we built in incentivizing wellness into the recovery ecosystem, it would really give people a reason to use the system, to stay engaged in the system. And, for communities and for people in communities that are struggling, another thing that Guy said, like sometimes it can be relentless, all of the bureaucracy and the red tape that you have to go through to get a treatment better, get into a shelter, or, whatever, see the doctor. You have to have this referral package, that referral package, this signature, that signature. And the thing is about the recovery ecosystem that's beautiful is that when a service user enters the system, all their information is there. And any of the service providers on the other side that are going to be providing services to the service users will have the information. Of course, the information will be protected and have, a bunch of security levels on it. But the goal is that for the folks who need it, it's not going to be hard. Whereas right now it can be very challenging, and there can be a lot of wait lists. And in a community-based environment with everybody working together, when you take the money, ego, and turf out of it, and somebody walks into a member of the recovery ecosystem that's, say, a treatment center like TWC, but we don't have space, rather than sending somebody to a 1-800 number that belongs to somebody who has really nothing to do with the person itself, we can actually seek out resources right inside the ecosystem in real time to be able to get direct access to another treatment better by another service provider that's in maybe the same ecosystem or an attached ecosystem. And that's what I love so much about the concept, is just the whole connection piece, and how with everybody working together, we'll be able to hopefully eliminate wait lists, provide fair and equitable funding to service providers, provide fair and equitable treatment to people who need it, and whatever treatment they want. Like we shouldn't be, the service providers shouldn't be the people that are telling people how they should be getting well. There needs to be a lot of options for everybody, where we got to meet them where they're at. And if they want to do something that one organization might not agree with, that's where the ego and the turf gets taken out of the equation. So I'm super excited about it. Yeah.
Am I correct then in understanding the difference from what currently exists is that right now funding flows through organizations and people basically have to choose between whatever is already there. But this provides more power to the individual person to access the support that they need at the time that they need it. So in other words, it flips the funding from a institution-led to a person-led decision making. Is that what I'm hearing from you?
Yeah, I really like how you put that and how we framed it, how we, when we've been strategically planning this for over a year now, and how we thought about it is that instead of funders and granting bodies and philanthropic donors giving money to an organization, why not give it to a third party that distributes the money based upon the services that are used, that a person decides in the moment what they need? And there's going to be a lot of benefits of that. Number one, we're going to be able to show people exactly where their money is being spent, and the most important is we're going to be able to start generating evidence. And it's not about evidence about what program or what service works better. The evidence is going to be what can we do when we all work together. And I think that is something that is very unique to this system is we don't want to prove that TWC has the best treatment services, that Union Gospel Mission or whomever else has the best food lineup. We want to show that when we work together, people can get well faster.
So Guy, does that fit with what you were saying about helping people get the support that they need on their own terms, right? And incentivizing their own recovery? Like, is that a fit with what you've been saying?
Yeah, constantly. I mean, listen, incentivizing things. I'd rather give people the carrot than the stick because for a long time we've just been giving people the stick. And to Susan's point, she's right. I mean, it's an astronomical amount of effort to try to get better. I mean, we just don't make it easy on people either. And there's a lot of people trying as well. It's just not, they're not able to always achieve their goals. But if we're working constantly together and the funding is going to the individual, I think each individual might have some different aspects that need to be addressed, and that's where I think this would be really impactful for people. But I also think too is one of the biggest things that I look at is that if somebody knows that they're going to go through treatment and not be homeless at the end of it, I mean, you take that out of the beginning of somebody going into treatment, they can actually start focusing on themselves to get themselves better. It is really hard. I mean, it's almost next to impossible for people that have been homeless for a long period of time to go into treatment to expect that after, 90 days, what do I do? Oh, I'm going to go to the anchor shelter. I can't go back to the anchor shelter or any shelter. I have to have something that's stable, that I know that's going to exist. And I think if we start focusing on that, we'll get a lot more people that will be willing to try. And constantly asking people who I work with, you can also give people some funding because, when you're struggling in addiction, you do things to survive to get your money.
Yeah.
That needs to be left at the door when you walk into recovery. And oftentimes what happens is that if I'm always relying on everybody else to, buy me a coffee or something, a lot of people just give up. And I think if there was a little bit of support to people going through treatment that had some excess things, going to the gym and et cetera, doing life things, going to a movie outside with other people. I mean, that's where we start putting some positivity back in people's lives.
Yeah, and you're giving power back to people, right? They're giving a sense of control over the decisions they make, and they're not passive recipients to the services that are handed down to them, by the powers that be. So I love that approach. I mean, I'm hearing that we're talking about a bottom-up approach. It's one that's really focused on the person as a person, and then connecting them to what they need in a timely way. And we're talking a lot about coordination. And so, Steve and I have maybe a bit of a slightly flippant question, maybe, but it's based on something real. Is it, I mean, you kind of surprised me when you said, yeah, I want to help raise funding for recovery ecosystem,
Mhm.
even though the funding will support multiple charities,
Mhm.
not just TWC. So Why are you raising funds for other charities?
My boss asked that same question, but no, I'm just kidding. He's very supportive of this. But no, the way I look at it is, it takes one team, one dream, honestly, and I don't want to sound too cliche here, but a big part of my position with Together We Can is out there building relationships and talking to people, both people who need treatment, but the people who are providing treatment, the people who are providing services. And again, there's a lot of people out there that have big hearts that just want to see our brothers and sisters get well. That's what it comes down to, right? The unfortunate reality is right now it's fractured, it's a little broken, we need to just fill some gaps in some areas. The reason why I like the recovery ecosystem and and the funding model with it is again because it takes away from the block funding. So when we're doing an activity-based funding, it's actually going to, I look at my own personal story. I needed help in many different areas. I needed housing at the end of treatment. I needed continued mental health care support. I needed continued medical care, all those types of things, right? And so when I go and look at that, I remember, I'm 90 days off of substances and I'm trying to navigate in a new city, let alone, I'd never even been to Vancouver. I'm trying to figure out where I can get mental health counseling and things like that while I'm in sober living. It was hard to navigate. And so if we have people who are already boots on the ground who understand the systems in their local areas, what works in Vancouver is not going to work in Trail, BC or in Port Alberni or in Terrace, right? We're going to be depending on local experts to put these systems together. They're going to be able to sit down and say, hey, we both know Bob. We all know Bob, right? And this is what Bob needs from us. This is what he needs from you. This is what he needs from whatever it is, right? But when our goal is for every person that enters the recovery ecosystem to find wellness and encouraging recovery, encouraging, quality of life increases, who wouldn't want to put their money behind that? Who wouldn't want to be a part of such an amazing system of care, honestly? I think David, one of our brilliant people behind the scenes here, came up with the person-centered social care revolution, and that's exactly what this is. It is a revolution. We have a lot of great people here in the province of British Columbia and Canada-wide, but we're gonna talk about BC today that really just want to help, that really just want to see something put together where we can help the individuals who are coming in and talking to us. And I sit on the board of directors for another organization that is in safe consumption and harm reduction and all these types of things. And we're already building a mini ecosystem, recovery ecosystem through that organization, and Together We Can, and helping people from the downtown east side who want to get into recovery. We're trying to speed up that process. And so there's an appetite out there for it.
Yeah, I mean, it's so exciting to hear that phrase, like a person-centered care revolution.
Mm-hmm.
That's exciting. And if BC can be on the cusp of that, that kind of triggers a little bit of healthy nationalism, maybe. But Guy, I think a lot of us, myself included, have heard a lot about the Alberta model as kind of the best in class, if we will. And I don't want you to start picking apart other models, but how does this model of recovery ecosystem that we're talking about today, how does that differ, helpfully, from some other well-known models across Canada or North America?
Well, I think every province does what is needed to be done in their specific province. I think you have different demographics. Obviously, British Columbia as well has a wealth of recovery services and a wealth of harm reduction services. Obviously, those are good. I don't really compare or enjoy comparing what model's better. I think it's really about what we do in BC. We have a lot of huge services, especially the Road to Recovery, which is going to be launched, which is being launched right across the province, which is actually, you can go into a hospital and get connected to addiction services, see an addictions doctor. Detox times limits are extremely lowered now. And the capacity with also the recovery community centers that we have in British Columbia as well have really provided a lot of connection to people before treatment and after treatment. So we're doing all these good things, and I think adding a component layer that actually empowers the individual to start going through these the ability to go through these systems of care that already do exist. It's really not trying to change what other people are doing. It's really trying to just add on to what people are doing so that people will have the ability to start saying, hey, I know there's going to be a top up on some things that I'm going to need, whether that's housing, whether that's going through treatment, whether that's, getting your ID back. You're going to, we take, for the people that I work with, I'll tell you something that is crippling for them is not having the poverty. If you
Yeah.
take some of the layers of poverty away from people, they'll be able to have the ability to, change and move forward. That support is crucial. And so I think with the recovery ecosystem, it's just really an added component to what already exists, but making it more in line with what everybody's doing.
Such a powerful idea of not having to reinvent the wheel, building on what's already there,
Yeah.
learning from others, learning what works, and just augmenting it, making it work even better and more connected.
Yeah.
Going back to that theme of connection. So, last question, and maybe Susan, I know that this is a one close to your heart. Is what does success look like? How do we measure success, and how if a donor supports a recovery ecosystem, how will they know it's working?
That is a great question. And, we designed the recovery ecosystem around Maslow's hierarchy of needs, with the basic safety and security that one needs, all the way to self actualization and everything that comes in between it. Me, of course, as a recovery advocate, as a person who's dedicated my life to helping people find recovery, I think a good outcome is not only people getting well and getting healthy, but for them to have some purpose and whatever it might be that drives them forward in their life. Not everybody's going to be a recovery advocate, but I know I've been in this industry for, over 17 years now. And, we've seen people make such great achievements. I mean, we even look at Guy's great achievements, Steve and myself, and there's countless others that have high position jobs in health authorities and are leaders in other organizations. And maybe it's just that you want to go home and you want to be a good mom and
Yeah.
you want to be there for your kids every night when you go to bed, or you want to be a good dad. So I think self-actualization to me means whatever purpose it is that you want, that drives you in your life, to be a good person. And that's all I really want for everyone.
Yeah, I mean, I love that we keep bringing the conversation back to the person, to the individual. This is a conversation about moving from silos to systems, and yet even when we talk about systems, it's really the person, it's the individual at the center of it. And I love that your answer about success is really, it goes back to that, about the ability of an individual to thrive, to recover and to sustain that recovery. I do have some questions I want to get to, but Stephen, Guy, I just want to give you a chance also just to throw in any thoughts about the vision for the future and what does success look like from your lens? I mean, if you fast forward 10 years and there's like a young guy who's in the midst of their own struggles, how do you think things would be different as a result of recovery ecosystem?
Well, I mean, if you, it's powerful in the sense that it'll give people some hope. I think when I look at my whole life, what I struggled with is that, I don't really have, I'm not really a guy that focuses on staying sober for the rest of my life. I'm the guy that focuses on staying sober today.
Mm.
I have set goals that I try to accomplish and achieve, but really every day I get up and know that there's some people that have really helped me along the way, that and what they did for me. When I look at the recovery ecosystem, it's funny because there's people that provided that ecosystem in my life that kept me alive for the decades in the downtown east side, that helped me get into recovery and treatment. And one of the things that I often talk about is that the ability to have it all connected through both harm reduction and recovery in a seamless, timeless system of care that has the approach to housing and the other social determinants of health. I mean, that to me would be the thing that we understand, that, hey, there's going to be setbacks and challenges in people's lives. And I don't know anybody that I've ever met in recovery. I don't meet too many people that have ever gone in it once and just walked away and got a good life out of it. they went back to the well numerous times. And so it's really important to really have all the tools available. And that ecosystem would include also the harm reduction services, because they are also supremely vital in giving people the access to recovery ecosystems. So
Yeah, no, it's again, you always leave me with optimism that look, we have a lot of things that are working in the right direction and we can just do more. We just need to step on the gas and accelerate this, right? So yeah, thank you for sharing that. Let me get to some quick questions and I'll throw them to anybody who wants to answer. Um, you talked about communities having an ecosystem or network of service providers to support people in their recovery journey. How do you find or recommend finding those organizations or service providers in the different communities?
That's a great question. We've been doing a lot of thinking about that. I'll take that question if that's okay, everybody. And we've put together a whole implementation strategy, which involves stakeholder engagement and community engagement. And one of the main things is each community or each ecosystem, there's going to be two levels of advisory boards. First, there's the provincial advisory board, and then there's the community advisory board. And the community advisory board will be instrumental in bringing in the service providers. And, we're really looking for anybody who's providing services, whether it's harm reduction, a bank, a school, a food lineup, a clothing giveaway support system, treatment centers, shelters, like everything that's needed in social services. We want to break down the silos. We want the recovery ecosystem to be the silo of services for people who need support and they need wellness. And so that's the key thing that we developed, is the stakeholder engagement and steering committee.
Thanks, Stephen. Did you want to add to that? I saw your
No,
no.
Susan hit the nail on the head, right? It's we have to go back to the local communities and find out what they need. I don't know what Duncan needs. I don't know what Terrace needs. The people that are on the ground do, and they can create their recovery ecosystem that best suits their community, and then bring it back to the provincial board so we can look at how do we best fund this and make sure it's equitable.
And certainly what I've appreciated just in, again, getting to know the work you do is that you take the time to listen and you dialogue. So you go to these communities and you learn. I mean, you speak with local authorities, the health authorities, you speak with the service providers, and you speak with Indigenous communities and Indigenous providers, and you just start asking questions and pulling pieces together. So it's a beautiful approach. Another question came in. You've made a powerful case for and contextualized the difficulty of finding the right service at the right time for a person or family facing addiction. Arguably, that applies to donors too. Is that right? What advice do you give to people who want to support this cause to help them navigate how to give their time or money effectively?
Yes, absolutely. Is it okay if I take that one?
That's a great question. Yeah.
Yeah, awesome. Yeah, and it kind of goes on to Jen's question there too. So maybe I could answer both too, because Jen was saying how to stay up to date. So absolutely, when it comes to donors, is right now there's a lot of people that do want to give money and help support people getting healthy. A big part of my job is paying attention to what is being said on like Facebook, for instance, in the community groups, and it's not a very pretty site right now. But I do know there's a lot of people out there that just want their communities to be safe and whole. And so when it comes down to donating or giving your time to your local recovery ecosystem, things like that, the nice thing is when we're pooling it all together here up through the Charitable Impact Cause Fund, is you're going to be able to say, hey, I want this to support this geographical area, or I want to support, a certain demographic, or, I just want to generally support this. So it actually gives a lot of options to people who want to donate. And then also, where do they want to give their time is an important piece. So very similar to if we look at Together We Can. I'm not going to go on a big thing about it, but we're a treatment center. We have a medical team, we have a nutrition team, we have a pharmacy team, we have a maintenance team, we have a mental health team, we have all these different teams. And so we're able to actually get people who want to volunteer in mental health. They're able to work in the mental health side, or maybe they want to volunteer in the nutrition and fitness side of things. So the nice thing is it's all in one area, and so we're able to provide those services and a very clear definition on how to access those services, whether it's you as an individual needs to access the service and use it, or you just want to get behind it. So I hope that answers that question. And then again, how would you be kept up to date? So again, cause funds and charitable impact, I can't say enough about how great they are, is, they're the ones, they're going to be collecting all the information and things like that. And we're going to be able to send out updates by email and be able to contact those who are donating, and share those stories, obviously, protecting anonymity and the people who want to share their story, absolutely. But the way we're really looking at doing that right now is going to be through newsletters, e-newsletters, and we do have a website, recoveryecosystem.ca. It's pretty basic right now, but that's where we're going to share more stories and the impact of what's going on in different communities. We didn't get a lot of time to talk about the technology, but Susan has done a fantastic job of putting together this technological piece, and the data collection that we're going to be able to look at and say, hey, this is where we are seeing quality of life increases. It's going to be amazing to be able to share that with communities, with, the people in Powell River or Trail, or I keep saying the same towns over and over again. Sorry if I've missed you, but, it's going to be really cool that we'll be able to share that with donors and the community members.
Well, I think it is important also to emphasize that this is going to have to start small to test this model
Yes.
at a community level before it could be scaled, right? And I think that's something perhaps we need to be very clear on. Maybe because I don't see other questions right now, that leaves the floor to me to ask one last question. And it's really around something that I experience quite frequently in my own conversations. It's skepticism. It's like, look, this kind of collaboration is a great idea, but come on, it's not possible. It's not feasible. You can't actually have a collaborative system working together in support of an individual. I mean, Guy, what do you say to this kind of skepticism? I mean, is this a possible world that we're creating, or is this just a pie in the sky dream here?
I honestly believe for a lot of it that a lot of us do work together. We all know each other. We know the circles that we travel in. I think there's some that don't, and for various whatever reasons they are. I think what's killed us is this division that was created, and there's nobody that I've met, whether it's in harm reduction or recovery, that wants people to struggle on the street. Everybody wants the same things for everybody to get better. We don't like seeing people struggling. It's very challenging to work with people struggling. There's a lot of complex challenges that people are dealing with. And I think so many people in our province do such great work, and we're helping the person, and the success is really in the eye of the beholder, not what I deem as successful. You have to look at somebody's life and where they're at. And if we can make that better, their health and wellness when they're moving forward, they're not struggling on the street, they're not homeless anymore, they've got a place to live, they've got, some employment, they've got some purpose in their lives. If somebody is happy with that, then I'm just very happy for them. I don't, I've made numerous mistakes throughout my life, and I'll tell you something: when you think you have life, it crushes you and humbles you. And so for me, when I look at the success of people, when somebody says to me, hey, I've been 3 months off alcohol, I'm just really happy for them that they even shared that with me, or and so the beauty is working with people, and I think I'm just very hopeful. I mean, listen, I think anybody that survived addiction and their perseverance and their struggles to get to where they are today, you can't do this work if you're not going to have any hope. And hope is really the anchor of the soul. And I believe we have made some really good progress, especially in the province of British Columbia.
Yeah.
I just think we can do a lot more, and I don't think anybody disagrees with that.
Absolutely. And I personally have been inspired by the role of philanthropy in British Columbia as well. I know Charitable Impact did a bit of a case study a few months ago on the Road to Recovery initiative, which was a beautiful example of how philanthropy can drive positive change and inspire partnerships with the public sector, getting the private sector involved. And Guy, I know you've been involved in that success story as well. And so I hope we can all learn from that, be inspired by that, and continue on that path of philanthropy inspiring positive change at scale. Just before I close off, I saw there was one last question that just squeezed in, and it is this is such an inspiring initiative. What phase are you in?
Mhm.
Building out the ecosystem. Are you already engaging communities?
Yeah, we are. And so we've been doing it for quite a while now, Susan. Hey, her and I just travel around everywhere asking everybody questions. But right now, if you look at it from that perspective, is Susan and the team are working really heavily on building out what the technology should look like. And then we'll be bringing that out to communities and saying, hey, this is what it will look like. But we are waiting for funding for our feasibility studies. So we have to go and speak in a more formal way with obviously key stakeholders. We're looking at maybe Powell River as our pilot program community. So we want to get out there. We want to talk to the service providers. We want to talk to the people who will potentially be using the service. We want to get out there and just get a real feel for the community. So we're hoping right now that the pilot project will be ready to go, in the new year here, and we'll be able to actually fund this and build that out so that we can, again, start small. It'd be great if we could just do this all over the province, but that's not realistic. And then bring it out so that, by 2027, I think we'll have a really solid plan of action with some data behind it. And then we can start scaling that up a bit more.
Fantastic. Oh, viva la revolution.
Absolutely.
That's amazing. Thank you so much for spending the time today. I know that this is a cause that's easy to understand. We all share a passion to see this addiction crisis resolved, or at least mitigated in BC, but the solutions are not as straightforward. I think you've done a great job today trying to demystify it a little bit. If people want to learn more, get involved, get engaged, donate, but talk to you, I think you can go to Stephen at recoveryecosystem.ca. You can also check out their fledgling website, recoveryecosystem.ca, and you'll soon be able to find it on Charitable Impact as well if you look for Recovery Ecosystem. So again, Guy, Stephen, Susan, thank you so much for your time. Really appreciate it.
Thank you
Thank
so
you.
much, Kevin, and thank you for everything that you're doing at Charitable Impact.
Mhm.
It's our pleasure to support. And thank you everybody for listening today. Really appreciate your time too.
Absolutely. Yeah, thank you everybody who attended as well. This has been great. Thank you.
Thank you.